when you are seeking the Part C of your Medicare coverage, it is very important. We have to adhere by these rules according to CMS, the Center for Medicare and Medicaid Services. We have to adhere to what's called a scope of appointment,
Yes.
which, okay, before we can speak to you about any of the different plans, you have to get a scope of appointment. What a scope of appointment is, okay, it is permission for us to speak to you about a specific plan, because seniors, okay, especially what we call the special needs population, is a vulnerable population.
Yes.
So they're very, very well protected by CMS. So they really don't want you to go in there and speak to them about health insurance and also about life insurance, long-term care, and you have all these sales that you're doing. You have to check off that you are going to speak to them specifically about Medicare and prescription drug plan.
And just a reminder, we want to make sure, and I'm going to tell all my Medicare people out there, when we walk into your, whether you find us at a CVS or we go to your house or you come to our office, you must tell us about your medication. We are not supposed to ask you, what are you taking?
You have to
take that information. So be careful. So I'm just letting all my brokers out there know, as well as my Medicare clients, that we are not, absolutely not, able to ask you, what are you taking? You must give us that information.
Correct.
So that we can figure out what your tier is in the formulary of the plan you're choosing.